Hey beautiful people, today it's gonna be nursing in UK versus nursing in Australia. If you're just seeing my face for the first time, hi. Welcome to my channel. So I have practiced nursing in the UK for 4 years. For a bit of context, I did 1 year in aged care. I did 2 years in the medical cardiology ward, and I did about 10 months in anesthetic nursing. So that's a bit of my background in the UK. I am currently here in Sydney, Australia, and I currently work in anesthetics. Okay, right. So let's get into the differences I have noticed between the UK and Australia. Bear in mind that these differences are mostly my experience, and whilst it is my experience, it might be different from you depending on where exactly you work in the UK and where exactly you work in Australia. Okay, so this is just my experience, and I hope it gives you a little bit of insight about both countries. I want to start off by saying both countries are amazing, good places to work. I do not regret anything so far in both countries. They both have their advantage and disadvantage, and we're going to be talking about all of them here. I wanna flex my love. I wanna impress. So the very first difference I noticed about UK and Australia is the working hours. For the UK, full-time hours is 37.5 hours per week, whilst in Australia, full-time is 38 hours per week. Okay, now these are the full-time hours. If you work part-time, you decide how many hours you want to do. As a full-time worker in the UK, a majority of the nurses do work 12-hour shifts, so 12.5 roughly, and it goes for 3 days. Now a month we have 4 weeks, so 3 weeks you do 3 days, and then your fourth week you do 4 days. However, here in Australia, when you work full-time, most nurses do work 8-hour shift for 5 days. Okay, still on the working hours, in Australia, full-time workers will work only 19 days a month. So while we work 5 days a week, a particular week you are allowed 1 day off, and that day off is being paid. So you have 1 day off every month. Some people take the money and some people add it to their annual leave. Okay, I'm going to be talking about the annual leave a bit later, but generally this is how we work. You might find some nurses in ICU or in ED here in Australia work 12 hours, but it's very rare occurrence. Okay, so majority of the nurses here would do 8 hours. Okay, for me, I do prefer the long hours, the 12 hours, because then I have 4 days to myself to do whatever I want. However, the downside with the 12 hours is when you come back from your shift, you really feel the standing and the working for 12 hours. You're gonna feel the pains. Okay, that's what I'll tell you for sure, especially if you work in the wards. Now our shifts pattern, if you do night shift, you might work 9 to 10 hours. Okay, depending on when you start, you might work 9 to 10 hours, but roughly majority of nurses work 8 hours. Shift starts pattern. For shift start patterns in the UK, we normally start shift 7 o'clock or 8 o'clock. So when you start 7 o'clock, you're going to finish 7:30 p.m. or when you start 7 p.m. you finish 7:30 a.m. But here in Australia, you can start your shift around 6. When you start 6, you stop at 2:30. When you start your shift around 7 a.m., you stop around 3:30 p.m. and if you start your shift around 10:30, you finish around 7 p.m. So the shift pattern varies depending on what the ward or unit wants, and you can start by 2, and when you start 2 o'clock you stop around 11. Okay, so yeah, 2:30 to 11. So yeah, the shift pattern varies like that. Night shift here will start at 9:30 till 7 a.m. or it will start around 10 to 7:30 a.m. So it just depends on the facility. Nurse patient ratio. In the UK where I worked, when I was in the ward, I would get around 1 to 8 patients during a day shift. In the night, I'll get 1 to 10. It can go up to 1 to 12 in a night shift. Okay, that was in a medical cardiology ward. Okay, not the high level dependency cardiac unit. I mean, just a regular cardiology medical ward. Okay. I know for ICU it's going to be 1 to 1 or 1 to 2. That's standard everywhere in the world, I think. And when it comes to the aged care in the UK, I'll look after 20 residents, 22 residents. Here I haven't done any aged care work, so I don't really know how much, but on my research I found out that it's similar or it could be more here. For anesthetics, its standard is 1 to 1, so it is the same in UK, it is the same in Australia. So however, in Australia the ratio in the wards, general wards, depends on the state. So every state has their rules and regulations. I work in New South Wales and the ratio here is one nurse to 6 patients. And if you get a job in Victoria, that's the Melbourne area, they have a safety ratio rule. So you as a nurse, you cannot take anything above 4 patients. It's 1 to 4, even in the ward. So I love that about Victoria. So if you are going to Victoria, you are lucky. Okay, you're gonna get 1 to 4 patients regardless. I think Queensland as well, I'm not sure, but make sure you do your research. But I'm sure New South Wales, we don't have that law. Let's go over to the annual leave. So for annual leave, the UK has annual leave of about 28 days. If you work full-time, you have 28 days annual leave plus 8 days public holiday. But here in Australia, you get annual leave anything from 4 weeks, 5 weeks, 6 weeks. It also depends on if you accrue your days. So like I told you before, you know, you have 1 day off every month that can be paid or put towards your annual leave. So some people add those days and then they can take up to 6 weeks annual leave or 5 weeks annual leave. But I think the minimum you can get in a year is 4 weeks annual leave. Okay, and then we have the extra public holidays. It's up to 12 days public holidays. So yes, the annual leave in both countries are amazing. And there's something called the long service leave. Long service leave is applicable to both countries. So in the UK, if you worked with an employer for 10 years, you get about 41 days annual leave, okay, after your 10th year. But here in Australia, when you work with an employer for 10 years, okay, which I don't know how people do, but if you work with an employer for 10 years, you can get annual leave even up to 3 months paid annual leave. So yeah, it's a bit more here in Australia if you put in those factors. But yeah, generally both countries has an amazing annual leave, okay, I would say. Now this brings us to the sick leave. For the sick leave, I feel like the UK has it. In the UK, if you go off sick, no matter how long, you get paid full. Please let me know if I'm wrong, but I usually don't take sick leave in the UK, so I am not 100% sure, but I've never heard anyone complain of not being paid while they are sick. So you always be paid in the UK for your sick leave. But I think if you call in sick 3 periods in 6 months, you will be called in for questioning, just asking you question, and then after that, you can, if you call in sick again, you'll be made to speak with the managers. Like, there's just a lot of process, and at a point they might ask you for medical reports. But here in Australia, you are only allowed a sick leave for 10 days paid sick leave, and after 2 days your employer might ask you for a sick note from a medical doctor. So I feel like UK has it for that. And here in Australia, the good thing is, so in a year you are entitled to 10 days sick leave. If you don't take it in a year, you accumulate them, okay? So any days you have that you didn't take sick, you can accumulate it. So I would say if you are fit and healthy, you wouldn't have much problem. Another major difference between nursing in Australia and nursing in the UK is that in the UK, majority of employers, especially the NHS, would start you on a band 5 salary, which is you are being started off as a newly qualified nurse, regardless of how many years of experience you have in your own country. I've heard some instance where some nurses actually said they consider their experience, but I want you to know that this is a rare occurrence. It is not something that happens everywhere, okay? On the contrary, in Australia, it is compulsory. You will never find any employer that will not consider your years of experience. You will never. Even agencies consider your experience. Okay, so if you register to work with any agency, they will ask you how many years of experience you have, and they will pay you accordingly. Okay, but in the UK, if they say they are offering this rate, that's how much you offer, even if you have 100 years of experience with agency. Okay, correct me if I'm wrong, but it's very rare to see agencies in the UK consider your years of experience. If you are a charge nurse, it is a different thing, or if you are a specialist nurse, it is a different thing. But a general nurse, you're not a charge nurse, they pay you a base rate in the UK. But here in Australia, they do consider your years of experience. Even if you're not a charge nurse, you get paid how many years of experience you have. I don't know if that makes sense, but yes. When it comes to work stress in both countries, I would say it depends. In the UK, you would never go to any hospital and not find healthcare assistance. Okay, this is a plus for the UK. I feel like the UK has so many benefits. I won't lie. You will never find any hospital that does not have healthcare assistance. You will never walk into any ward. I do agency shifts in the UK, and I've worked in so many hospitals, so many. Some of you might have bumped into me during my agency shifts as well, and I've never gone into any ward and not find a healthcare assistant to assist me. A healthcare assistant is always assigned to me to work alongside with me. But here in Australia, I was shocked. In fact, let me not lie, I wasn't shocked. I knew already. I knew, but reality is different. I was like, you might have 1 to 6 patients and you will not have a healthcare assistant. But this is not the case in every state. Some states, they have healthcare assistants. Some hospitals, some units have, and some units do not have. But the unit I did work in, they don't have healthcare assistant. But like I said, I work in an anesthetics department, and we don't use healthcare assistants in anesthetics, so that's fine. But if you do general ward, you would not have a healthcare assistant, which is not too great. I mean, aside the fact that healthcare assistants are just amazing, it's just good to know you have someone to chat with someone to help you. It's just a good feeling, but that's not what you get in every hospital in Australia. There are some exceptions. There are some hospitals that you have a healthcare assistant in Australia. In the UK, you will never ever. If you go and you don't have a healthcare assistant, it's most likely there's just a shortage of staff. But they will not tell you, there is no healthcare assistant in this ward, or they don't have. It's a different thing when people are short staffed and when it's a rule that you work alone. That's one big difference. So that's why I always tell people, if you're in the UK, if you can get into a specialty that will not require to work in a general ward, please do, because you are spoiled. When you work in the UK, you are already spoiled with healthcare assistant helping you with things, and you come here and you find out that there is no help like that. It is like a big shock. Okay. And I've also heard some people say, oh, I'd rather have 1 to 6 patients and then I take care of all my patients, do everything myself, than to have 1 to 10 with a healthcare assistant. What do you think? Are you the one that wants you and less patient and you do everything, or you as a nurse to more patient and you have an assistant? Let me know what you think. I am a bit in the middle of both, because I like chatting with my healthcare assistants when I work in the ward, so I find it lonely working alone. Another difference between nursing in the UK and nursing in Australia is that for immigrant nurses, it will take you a minimum of 5 years if you follow the workers route to get your permanent residency. However, in Australia, you can get your permanent residency even before you get into Australia, or once you get to Australia, you can immediately apply for it as long as you meet the requirement. So like I came into Australia with my permanent residency visa. It will take me 4 years to get my Australian passport, but in the UK, it will take you 5 years to get your PR as a nurse, and also an extra 1 year to get your British passport. So if you're an immigrant, you might want to consider these 2 things as well. Now let's talk about money, the salary. I would like to say I will not go so much in details on salary here, and this is because I'm going to be dedicating a whole video to the pay in UK versus Australia, because I know this is a major factor for many people. So I don't want this video to be too long, so I'm going to do it in another video. But just to say, I have found out that the salary here is much more better than the UK. The salary depends on your state. Okay, every state has their own pay, but the difference is that the UK, if you live in, I think Scotland has a higher pay as well, unlike England. But generally, the least state here in Australia still pays higher than London. Right, let's talk about the overtime rates. Now, in the UK, correct me if I'm wrong, when you do overtime, some hospitals do not pay you an extra money, they only pay you your normal rates for every hour you work. In Australia, it is compulsory, your employer must pay you overtime rate, which is usually a time and a half or a double paid. Okay, if I work an extra 2 hours in a shift, I get paid a time and a half for those first 2 hours. Anything after the first 2 hours, I get paid double time. Okay, so double of whatever I should get in a normal for that time. Let's talk about the breaks pattern. Okay, so in the UK, when you do 12-hour shift, you are entitled to 1 hour unpaid breaks. I know that there are some care homes that pay you for your breaks. Let me know if your company or your hospital pays you for break, but I think NHS is unpaid. Yes, it's unpaid break, 1 hour. So we normally would take 30 minutes. If you work in theaters, you might have more breaks. Like in the theater, sometimes you have first 15 minutes coffee break, then you have 30 minutes lunch break, and you have 30 minutes dinner break, which is an hour to 15 minutes. But 60 minutes is not paid. But here in Australia, if you do 8-hour shifts, you get 50 minutes break. You have 20 minutes paid break and you have 30 minutes unpaid break. But generally, I would say the breaks here are more, because if I do 8-hour shifts in the UK, which is mostly agencies, if I have to, because I mostly work long hours anyways for my full-time job, 8-hour shift there will give me only 30 minutes unpaid break. Okay, so this one, it might not be too much of a big deal, but in the UK, nurses will pay registration fee every year, and it costs about £120. Here in Australia, our AFRA fees, which is like our nursing council board, we pay $185 per year, which is a little bit more expensive. But why are we paying to take care of people? We already pay to go to school, right? But another major differences I have noticed is if you are in the UK, whether you are a permanent resident as a nurse or you are just a tier 2 visa holder, you are entitled to the free NHS care, which is not totally free. It's paid through tax, the taxpayer money anyway, but yeah, you are entitled to NHS. However, if you are here in Australia, whether you are a nurse or anything, if you are not a permanent resident or a citizen or a particular type of visa, you might not be entitled to Medicare, which is our own type of NHS. So yeah, that's a big difference. Okay, so I always encourage nurses, you qualify for a PRO visa, just apply for it and come with your PRO to save you that differences. Okay, right, let's talk about career progression between the UK and Australia. When it comes to career progression, I think both of them are relatively the same. There's advanced roles here, we have nurse practitioners here, we have in the UK as well, we have clinical nurses here, we have clinical nurses also in the UK. So the career progression is great among both countries. And somebody asked me the highest paying specialties here in Australia. So for UK, I did mention that most people that are paid the highest are nurse endoscopists. They can earn anything about £100 per hour. That's if they work with agency, but with NHS they can be about band 7 pay. But here in Australia, one of the highest paying nurses are rural nurses, the rural and remote nurses, the nurses that work in the outback area. They get paid more because they don't really have doctors there. They do carry advanced assessment. They work without doctors there, so you can imagine the whole scene. They do advanced nurses role. Okay, they do pay them very well. They can pay them anything from 130,000. If you're going to UK as an international nurse, you need to write 3 exams: English exam, OSCE and CBT. But if you're coming in as an international nurse from Africa to Australia, you need to write 3 exams as well: the English test as well, OSCE, and also the NCLEX RN. So these are the 3 different types of exams you need to write for each country. Career advancement and support, when it comes to that, both countries wins. Like both of them have the same. Here in Australia, we have loads of scholarship, we have loads of grants. Like I am currently about to enroll in a postgraduate course that will be sponsored by my hospital, and those credits can be used towards masters. It's the same in the UK as well. I did my postgrad course in the UK. So yeah, both countries are very good with career advancement and progression. They just push you. So yes guys, these are the major differences I've seen between nursing in the UK and nursing in Australia. Thank you so much for watching. I hope you enjoyed this content enough to subscribe, and also share this video with your friends, especially those nurses planning to leave the UK to Australia. Is it really worth it? They might want to find out, and let me know what you think about these differences, and I'll see you guys in my next one. Bye.